Now, Senator Rand Paul will be unveiling pieces of his new ACA replacement plan. Now, Rand Paul, of course, is one of the only ones, Republicans, that decided, hey, I'm not going to actually vote to repeal the ACA unless you actually have something to replace it. And then recently, over the weekend, he said, look, I've got a plan. I'm working on it. I'm going to present this plan to replace the ACA. So hopefully we can do a vote to, repeal and replace simultaneously so we don't leave so many people out. Okay, look, that in itself is commendable. At least he's trying. The rest of the Republicans are like, I don't care. I'm going to repeal this bill because, that's what our big money donors want. In fact, they're going to get the 400 richest households are going to get $7 million just for the repeal of some of these taxes in a year. So some of the ACA taxes that went into place to be able to subsidize people who can't afford insurance, the donors say, I don't want to pay that. That's gone. That's an average $7 million a year savings for the richest 400 families in the nation. That's amazing. But again, that's why they want it gone. And Rand Paul at least is saying, hey man, I know we're going to get rid of this, but let's at least have something. Now on Sunday's State of the Union, he gave a couple of details on what that replacement plan might actually look at. Let's take a look. This is a real short clip, but it gives you some hints.
Replacement should be the same day. The replacement bill that we put together, our goal is to ensure the most amount of people, give access to the most amount of people at the least amount of cost. And I think this is where Obamacare failed. They wanted to insure people. Their motives were good. Their heart was in the right place. But they put so many mandates in it that they made it too expensive. So what's happening in the individual market, which is about 6 or 7% of the market, you have companies like Blue Cross of North Carolina losing $400 million because young, healthy people don't want to buy it because they're told, hey, you can get it anytime after you get sick. And so that they've broken the insurance model.
Okay, so look, there's not a lot of detail in that clip, and I've got more actually. But okay, let's just start out with some of the basic premises here. At least Rand Paul, I'm going to give him credit. He said, oh yeah, this plan that, by the way, Republicans came up with. He didn't mention that. Republicans came up with, well, their heart was in the right place. They wanted to insure people. However, here's one of the problems. Mandates. Too many mandates. Now, that logically, you would think, okay, well, since he's addressing mandates as being the problem, it's assuming that his plan will drop these mandates. Now, so what mandates are exactly is he talking about? I mean, because there are some pretty good things in there. For example, you've got the 80-20 rule, which is a mandate. Now, the 80-20 rule says insurance companies must spend at least 80% of the money they take in from premiums on healthcare costs. So look, 80%. The 20% can be, profit, can be advertising, etc. That 80%, that 80-20 rule didn't exist before the ACA. Now, you've got that mandate. I'm assuming that he wants to get rid of that. What about the mandate on that you cannot bar pre-existing conditions? Nothing on that. And what's interesting is that there are so many different things that could qualify as pre-existing conditions. In fact, I want to break down a list of what is considered a pre-existing condition. And some of these are going to be very, very obvious. And there's a couple on here that you might be left scratching your head, wondering how that got on this list. And this isn't a full comprehensive list. This is what I could grab real quick. Now, one of them is cancer. That's obvious, right? Okay. That seems like, oh wow, that's quite a pre-existing condition. You've got cancer right now. Okay. Heart disease. Again, understandable that that's on there. Third one here, pregnancy. Now wait a minute here. Pregnancy. Pre-existing condition. You know that fetus that we're trying to protect and that we're passing laws so that you don't abort it? Pre-existing condition. You've got to be kidding me. You've got to be kidding me. They consider that a pre-existing condition.
Give me a break.
Okay. So, look. You aside from pregnancy, of course, again, more obvious ones: diabetes, HIV, hepatitis, sleep apnea. Well, that's interesting. I didn't think that would be a pre-existing condition, but again, that makes sense. Now, here's where it gets a little vague. Mental disorders. Well, what mental disorders? Because there are a lot of different mental issues. For example, this would likely include things like anxiety and depression. That's now it's been considered a pre-existing condition. So if you were to sign up for insurance before the ACA and presumably afterwards, well, you would likely either get put into a high-risk pool or you would be denied coverage. I'm sorry, you've got anxiety. Well, okay, well that sucks, but how am I supposed to afford my meds if you won't give me insurance? Sorry, man. Well, that's going to make me more anxious and more depressed. Thanks a lot. But anyway, now you also have things like bipolar. I mean, look, this is a very, very broad definition. So really, this can include a lot of different conditions that you might not actually consider to be conditions. And that's the thing about pre-existing conditions. Now, a couple more, multiple sclerosis and muscular dystrophy. Those seem pretty obvious as a pre-existing condition. Okay. So that is nowhere near a comprehensive list of things. That's just, again, some of the stuff that I could grab. That is considered a pre-existing condition. Now, here's the thing, right? So, again, with pre-existing conditions, yes, it's going to cost money to cover those people. Oh, who'd have thought? It takes money to keep people healthy who have these conditions. No kidding. No kidding. So, speaking of mandates, well, you realize that that's why they put the individual mandate into the ACA. Why? Well, so it makes sure that there is enough money that the risk is spread so far throughout this pool that it makes sure that these people can still get covered while not having enormous costs. And again, enormous, more of like a relative thing. But regardless, that's the whole point of having an individual mandate. You get more people into the pool and you're spreading that risk around. Now, a lot of people might not be happy with that. A lot of people aren't happy with the mandate. I can understand that. And there are a lot of people that are unhappy that their premiums go to sick people, people that need care. I don't want my money going to that guy. The guy's diabetes. He got the diabetes by eating too much. Well, no, not necessarily. I mean, there are different ways of getting diabetes. I have a cousin who, I know, personal anecdote. I probably shouldn't even talk about it. But I'm just saying, this guy was like a bodybuilder and then got diabetes. There's ways of getting diabetes that don't necessarily have to do with eating poorly. Okay? There are just, and of course, you could get cancer from nowhere. So it's just, I mean, it's one of those things where people don't have empathy for others. Oh, you're sick. I don't want to pay a little bit more in my premiums, even if it might not be that much, to ensure that this guy is able to get his own affordable coverage, which, by the way, he's also paying for, but it's also getting subsidized. Again, we've got this whole lack of empathy. Okay. So, look, this is why the individual mandate was kind of important, an important linchpin to this very law. But again, not very popular. Now, Rand Paul also made the point near the end of the clip that needs to be pointed out because it's absolutely factually wrong. Now, you said that there are companies in the individual market that are losing money because young, healthy people don't want to buy in. That actually is it's true. There are people that don't want to buy in that are younger and healthier. Okay, that part is true. However, he adds, because they're told, hey, you can get it anytime that you're sick. And so they've broken this insurance model. You're essentially blaming younger, healthy people who get sick later on and are like, oh my God, I need insurance because the treatment for whatever cancer or whatever's happening is astronomical. I can't afford this stuff. So I need help. So that part's actually not exactly true. Now, under the ACA, you are actually not able to sign up at any time. There are enrollment periods. So you could, once that enrollment period opens up, you can sign up. When you're outside of it, you're SOL. You can't sign up through the ACA anymore. You can still sign up for a private plan, and I'll get to that in a second. but you can't get it through the ACA. Now, if you have a pre-existing condition, some of the stuff that I mentioned up there, and you actually still try to sign up for a plan outside of the ACA, and I didn't actually know this before, you can still get denied for certain conditions because you're not within the framework of the ACA exchanges. In order to participate, your plans have to not discriminate against people with pre-existing conditions, but outside of that marketplace, where insurance companies can still go, because remember, there are insurance companies that pulled out of the market. Well, now those people are SOL. Okay, if they're outside of that enrollment period. So again, Rand Paul not exactly correct on that assumption of why the system is broken. There are many different explanations of why the ACA doesn't quite work. And one of them, I think, is because it's a for-profit healthcare system. Whenever you have something predicated on profit, it's going to leave people out that are too expensive to cover. And again, that's what Rand Paul's focused on. He's not focused on covering everyone. The Republicans aren't focused on covering everything and everyone. What they're focused on is, let's cover as many people as we can, but make sure that it doesn't cost very much. Let's look out for the health insurance companies. Let's look out for federal government spending. Where for me, and some of you might disagree, but I think, hey, let's spend money on people's health because that's kind of important. It's kind of the most important thing that you can have. If you don't have your health, then you can't possibly have a happy and productive life. You can't go out there and create businesses. You can't go out there and get a good paying job if you're constantly sick. You can't keep your job if you have cancer and you're going to die in 6 months. It's kind of important to be healthy. But anyway, now he also, and this is outside of the video, but he had more stuff because I couldn't get the whole video. Now he continues by saying that one of the reforms he wants for his replacement to the ACA is to, quote, legalize the sale of inexpensive insurance. Now, what exactly does that mean? I don't know. I don't know why it's not illegal, or why it's not legal, or whatever, to sell inexpensive. Oh, actually, you know what? I do know what that means. That actually means let's return to the junk plans before the ACA that didn't actually cover everything. Those things that were barely considered health insurance. Basically, if you want to put it into car terms, because car insurance might be a good thing to contrast it with. This is like the PLPD of the health insurance world. Basically, hey man, if for PLPD you crash it, you're screwed. Okay, you have a very, very high deductible and barely any coverage. That's essentially what these inexpensive plans did. This is what these inexpensive plans did before the ACA said, okay, you can't do that anymore. You can't have these junk plans that qualify as barely insurance. No, you can't do that. We got to get rid of them. That's why a lot of people, a lot of right-wingers especially, were pissed because their plans got canceled out by the ACA. What they didn't realize is they were essentially paying for barely any coverage. But now he also said the replacement will also allow, quote, individuals to come together in associations to buy insurance. Now, again, what does that even mean? Like, does that mean that you and your friends are going to get together as an association and buy insurance? I don't know. That maybe I don't know. The thing that I thought about when I read that was like, at first, I don't quite understand what he's going for. Number two, it kind of sounds like you're unionizing to buy insurance. That sounds weird. So I don't quite get what he's going for, and I really don't get what he's trying to do with this. How that even is supposed to solve any of the issues endemic with the ACA and with our healthcare system in general. Now, finally, he gets into some policy specifics. Two things. He said, quote, we're going to help people save through health savings accounts as well as a tax credit. So there's your specifics. That's it. Health savings accounts and tax credits. See, for those who are unaware, health savings accounts is basically where you can store money for your healthcare tax-free. You save that money, you put it in that account, and it doesn't get taxed. Oh, and that's it? Okay, well, look, it's actually a pretty good plan if you've got money to put in that account. If you've got a lot of money. If you're upper middle class or if you're the top 10%. Hey, that's great. You store some money in there, you can save up some serious bank, and then if you get sick, you can cover at least part of it. For poor people, however, that tends to not be the preferred method of insurance. This is essentially a boon for the wealthy. And look, they also get tax credits for having it. Again, that's going to help rich people. It's not going to help poor people or people with pre-existing conditions, which will likely be put into high-risk pools, which, yes, do get subsidized by the federal government, or might be, I don't know what Paul's plan is going to look like on that front. But that's how it's traditionally done with a high-risk pool. It does get some government subsidies to help bring down the cost. But it doesn't interfere with everyone else's insurance because they're in a separate pool. I guess that might lead to lower insurance costs, but still, it doesn't sound, it's going to lead to lower insurance costs for some people, but taxpayers will still be subsidizing people in those high-risk pools. So again, I don't see like the difference. Maybe there's a little bit, but again, I'm not really seeing it a whole lot. Okay. Now, as far as poor people who don't have pre-existing conditions, well, they're kind of SOL. Because you're not going to have money to put in that health savings account. And a tax credit's really not going to help you all that much if, again, you're too poor to take advantage of a health savings account or that tax credit. So, again, this is screwing the poor. I mean, what do you expect them to do? Expect them to go to their magic money tree, take some money off the tree, and put it in your health savings account? No, they're poor. That means they don't have money. That means they can't save money. People who are poorer generally spend most of their income on the basic necessities for survival. Things like food, things like rent, things like gas, car insurance, stuff like that. Or student loan debt, which is a big problem as well. They don't have a lot of money to stick into a health savings account. And even if they do, God bless, put $20 into a health savings account every week, okay? Like, hey, I'm doing good. I'm saving some money in my health savings account. And suddenly you get cancer that costs $300,000 to fight. Well, that $20, even if you put it in for several years or a decade, it's not going to get anywhere close to matching that $300,000 cost. And I'm just throwing that out there. I don't know how much cancer costs. I'm assuming it's not cheap. So I'm just throwing that example. Okay. And look, as far as how much money they can even put into health savings accounts, you got to remember there's right now a big issue with people in America paying over half their income just to rent a place to live. You think they got extra money, even that $20? You think they got that money that they can throw into a health savings account? But it's tax-free. It's not going to help. It's a bad plan for poor people. And look, there's no details on whether or not Rand Paul is going to keep Medicaid the way that it is, or change that, or expand it, or whatever. Odds are, it's not likely to have any of that stuff involved in it. So I'm really curious to see how this plan is even going to help the poor. Because those are the people that are at the most risk. And ironically, those are more or less a lot of Republicans, a lot of the very people who voted for Donald Trump, who voted for people like Mitch McConnell or people like Rand Paul in Kentucky, which, by the way, Kentucky, they had something called Connect through the ACA. The people loved it. They hated Obamacare, but they loved their Connect without realizing that it was the same thing. So, look, man, for me, looking at this plan or even what we know so far of this replacement plan, it seems like it's another obvious way to screw poor people and to benefit rich people. A tax credit, as I said, it's not going to help people. Okay, a health savings account is not going to help poor people. What is Rand Paul going to do with for the working poor? How is he going to help them afford insurance? And so far, I have not seen any answer on how how even Trump care is going to be able to cover people who are poor. And I think the reason is because they don't have a plan. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent, non-corporate media, go to our Patreon page and become a patron. Patreon.com/TYTNation.